For decades, cancer has been portrayed in the public imagination as a genetic time bomb, an unavoidable legacy inherited through family lines, a cruel twist of fate written into our DNA. While genes certainly play a role, this dominant narrative is not only misleading, it's dangerous. It obscures the far more common and modifiable drivers of cancer rooted in our environment, behaviors, and social structures. Among these, obesity stands out as one of the most powerful yet consistently underrecognized culprits. In truth, only 5 to 10% of all cancers are attributable solely to inherited genetic mutations. The vast majority, upwards of 90%, are linked to external factors: poor diet, inactivity, environmental toxins, chronic infections, alcohol, tobacco, and, increasingly, obesity. This isn't just theoretical. The World Health Organization, American Cancer Society, and dozens of peer-reviewed studies confirm it. Lifestyle and environment profoundly shape cancer risk, progression, and survival. Yet the myth of genetic destiny persists, often reinforced by media narratives, underfunded prevention programs, and a healthcare system that favors reactive treatment over proactive change. Obesity is a prime example of this disconnect. Excess body fat is now a known risk factor for at least 13 cancers, including colorectal, breast, postmenopausal, endometrial, kidney, pancreatic, liver, and esophageal cancers. And the list keeps growing. What's more troubling is that obesity doesn't just raise the odds of developing cancer. It fuels tumor growth, makes treatment less effective, and worsens survival outcomes. In many cases, the metabolic, hormonal, and inflammatory changes linked to obesity create a biochemical environment that actively supports cancer at every stage, from initiation to metastasis. So, why is this not better known? Part of the answer lies in how we talk about cancer. There is a cultural comfort in the idea that cancer is random or hereditary. It absolves personal responsibility and shifts the focus away from industry, policy, and systemic inequality. But this narrative hides the reality that many cancers are preventable and that millions of cases worldwide could be avoided if we took obesity and lifestyle modification seriously. Public health campaigns have long emphasized smoking cessation and sun protection as cancer prevention strategies, with great success. Yet few campaigns have equated maintaining a healthy weight, eating well, or staying active with cancer prevention, despite the scientific consensus. The result is a profound policy blind spot. National cancer strategies often fail to fund or even mention obesity as a modifiable risk, even though it's driving alarming spikes in cancers among younger adults. This silence is particularly deadly because obesity-related cancers are on the rise, not just in developed nations but globally, including in low- and middle-income countries where processed food consumption and sedentary lifestyles are increasing rapidly. As obesity rates soar, so does the cancer burden. Yet prevention messages remain locked in outdated frameworks that focus on genetics, screenings, or treatment after the fact. There is also a moral discomfort in acknowledging lifestyle links to cancer. People fear being blamed or shamed. But this is not about blame, it's about empowerment and evidence. Recognizing the role of diet, physical activity, weight, and environment in cancer doesn't mean blaming individuals. It means confronting the broader systems that make unhealthy choices the default. Fast food advertising, food deserts, ultra-processed diets, work environments that encourage prolonged sitting, and inequities in access to exercise and fresh food all shape cancer risk far more than any gene ever could. At the cellular level, the connection is clear. Obesity alters hormone levels, particularly estrogen and insulin, creating conditions that stimulate cell division and inhibit normal repair. It increases chronic, low-grade inflammation, which damages DNA and weakens the immune system's ability to detect and destroy malignant cells. It disrupts autophagy and nutrient-sensing pathways like mTOR and AMPK, which regulate cellular growth and survival. These aren't abstract mechanisms. They are the very pathways that drive tumors to grow, evade treatment, and spread. Worse still, excess weight can mask early cancer symptoms, leading to delayed diagnosis and poorer prognosis. Fatigue, bloating, or abnormal bleeding, early signs of cancer, are often dismissed or misattributed in patients with obesity, allowing disease to progress silently until it's harder to treat. This creates a grim feedback loop. Obesity increases cancer risk, obscures detection, complicates treatment, and reduces survival, yet it remains marginal in both public awareness and health policy. We are at a critical juncture. Cancer rates are climbing. Obesity is now considered a global pandemic, and younger generations are showing signs of metabolic disease far earlier than their parents. To continue pretending that cancer is mostly genetic is not only scientifically inaccurate, it is morally negligent. It delays action, deflects funding from prevention, and reinforces fatalism in the face of a largely preventable crisis. We must radically rethink our approach to cancer. That means shifting from a reactive model of late-stage diagnosis and costly treatment to a proactive model rooted in prevention, education, and systemic reform. It means integrating obesity prevention into national cancer plans, investing in healthier food systems, taxing harmful products, reshaping urban environments to support movement, and ensuring equitable access to preventive care. And above all, it means telling the truth. Cancer isn't just in your genes. It's in your food, your environment, your lifestyle, and your community. And that means we can fight it, not just in the lab or the operating room, but at the grocery store, in the school cafeteria, in urban parks, and through the policies we demand from our leaders. The next generation of cancer prevention must stop ignoring the weight of the evidence, literally and figuratively. Because until we face the lifestyle and environmental roots of cancer head-on, we are simply treating symptoms while the causes continue to grow, unchecked and largely ignored.